Okay, I'm Catherine. I'm here at the St John's Hotel in Solihull on the Meta Health Practitioner course, Module 2. My background is in working with patients with chronic disease, chronic illness, physical and emotional. I've always kind of worked with patients who have some kind of illness, and my job was to help them to be able to self-manage their health and take responsibility for aspects of health while still working with their healthcare professionals. What I saw on that journey was a lot of emotion and a lot of similar patterns in patients with similar or same diseases. I've been on a journey for a long time in relation to self. From sort of like counselling, EFT, going into those deeper journeys, and part of it was for my own reasons, my own personal reasons, and part of it was because I knew from working in the NHS there had to be something more. There was something missing where we were treating patients and we were treating the symptoms, but we were just holding them at bay. And I always found that the emotional difficulties that people went through were sometimes harder for them to deal with than the actual physical discomfort of what they had. So I came to the Meta Health Academy just searching on the internet, really. I attended the intro talk in 2013. And then I went to the Meta Health conference that Joe and Rob had organised with the conference team here in Solihull, and I just knew at that point that I wanted to come back and start looking into this a lot more deeper. I lived with a long-term illness myself from a very young age, emotional and physical, from a young child, and I knew that that illness, especially the emotional side or the mental side, was not me. So I was always kind of in conflict with myself, and I knew that there had to be something deeper going on with me. And when I came to actually look at Meta Health, I knew that this was the tool and this was the key to finding out why I have these programs running or why I have these biophysical symptoms, and how the emotions and the social and the environmental and spiritual and physical all sort of link together. Like I say, I mean, from a personal point of view, something just resonated with me. You know, the actual medical, I'll say medical bit, but the actual system that I looked at with the Meta Health resonated with me so much, and to be able to put the two together, so to work from a holistic point of view rather than a reductionist point of view, I knew that was the key to me, because I know working in the NHS, as much as everybody tried to do the best they could, it was always somebody else's responsibility for something else. So the thing about Meta Health was that you can work with a patient and treat the whole of them, instead of having to send them to different areas or specific specialist areas. And I think for myself, from a personal level, was I just had a baby. She's 20 months old now, and I knew that from a personal level she's not going to pick up the same patterns and programs that I've had all through my life. And for me, that was the catalyst really to start pushing myself to look deeper into myself, and actually find some peace within me, because I want her to grow up in an environment which is closer to her consciousness, without my patterns and without my belief programs that are running. And from a professional point of view, I've never seen anything that doesn't get to everything. Everything all links back. So it's not just a case of, oh, someone's got a pain, or someone's got a thing, something up with them, or someone's got a diagnosis. You can track back with the timings, you can track back to when it happened, what happened with it, what the person was in conflict for, and you just can't find that within normal healthcare. You can find certain things, but you can't find the depth of what you find out in Meta Health. I haven't seen anything like it, to be fair, and I've worked with a lot of different, how could I say, different modalities really. It's tough, but when I say it's tough, it's challenging, because one, you're challenging yourself every time you come on, because it's not just a course where you're just here to learn academically. You do learn academically, but the most important thing you're learning is about yourself. And if you learn about yourself, then that's half the battle. It's not an easy journey when you're trying to open up and face yourself, but it can't be any harder than going through the emotional pain and baggage that you carry with you for years and years and years and years. So I think, well, what's a couple of months or years of discomfort to clear things out, or would I rather just have a lifetime of just living the same patterns? And I know now which is what I want to do. That's a question that I could answer easily. They're very supportive, very accommodating. They know their stuff, which is key. But in knowing their stuff, they also let you explore your own feelings and your own judgments around what they are saying. So it's not just a case of, oh, Meta Health, this. They're letting you find out for yourself about Meta Health and how it relates to the world, especially if you come from any background where it's all just been sort of a medical model. It's sometimes harder to switch over for some people, but for me, I found it just totally enlightening, because it's just brought together all the things I have been looking at over the years, and their knowledge just gets better and better every time I see them, and it's nice to be a part of that, because I know that they'll support me during my time as a Meta Health practitioner. I feel like I've got somewhere to come to feel supported, and they're on their own journey as well, so things come up for them. And things come up for us, but they've always supported us, and they've never ever left us in limbo. So if something comes up for somebody which is big and deep, they don't just let us go out the door at the end of the day. They will make sure that we're supported. And also the group that we're working with is just such a wonderful, wonderful group of people. We've all come together at the same time, and I think there's a reason for that. I don't think I could ask for anything more really in relation to the values that I've gained. It just makes me see that that I am self and I am me, and it just deepens my values of life really, and the important things in life and the simple things in life, and that was always going to be who I wanted to be. So it's just empowered me really to look more deeper into myself and face self, knowing that self is okay. But also it just makes me think that there's a big world out there that can be explored on a conscious level. And I'm just happy to be a part of that. My family is valuable to me, and if I can teach people who I love and teach people who I care about the values of Meta Health, then I'm spreading the word. And once people start to see the changes in me, which people have done, then it's of value to anybody. It's a journey. I don't think there's ever going to be an end to it for me, because you're always learning. But to be able to get in touch with your real self, knowing that you've got a program that is always giving you the answers, but always testing you as well is just something that I don't think I could ask for anything better. So if I was saying to somebody who wanted to think about booking on a Meta Health course, just go through, if you've got any fears, any reservations, that's good. Just book on it anyway. You don't have to take in everything you see, and you might wrestle with some of the things and you think, oh gosh, I'm not quite sure about that, but that's okay. You know, it's a journey, and it will open your world and your eyes to something that you might not ever be able to experience. And I think the most important thing for me, the most important thing for anybody on Meta Health training, is it just gets you back in touch with yourself, and I mean your core self, not the identity that you've built yourself up with, but it starts getting you in tune with you and who you are. And I don't think you could ask for anything more than that. Thank you.